Alright, so we're moving to the next issue, which will basically be discussing on a general note. So this abdominal tumors. Okay, abdominal tumors. So abdominal tumors, of course, is any tumor that could actually come up in the abdomen region. Alright, but the thing is, the abdomen region is quite complex, right? So these tumors could actually come up from any structure within the abdomen. So for the abdominal tumors, we said that they are just abdominal growths, okay, and the growth is actually located within the abdominal cavity, okay, in general. So it can be benign, that means it is non-cancerous. It can be malignant, which is cancerous. Do you understand? So for the abdominal tumors, what we're actually trying to look at the in-depth is to now look at the possible type of abdominal tumors, right? So the bulk of this lecture, the most important thing is actually the examples that usually come up, So it may arise from any structure within the abdomen, okay? So for the 9 quadrants of the abdomen and the different organs that are actually under, okay, the tumors could actually originate from any one of them. So when it is cancer, that's malignancy. You can have colon cancer, you can have stomach cancer, you can have liver cancer, you can have pancreatic cancer, you can have kidney cancer, you can have uterine cancer or ovarian cancer. I have neuroblastoma. I think that's like Wilms tumor, right? Okay, no. Wilms tumor should be nephroblastoma, right? So you can also have the gastrointestinal stromal tumors. Okay, so benign growths. You can have ovarian cyst, uterine fibroids, pancreatic pseudocysts, lipomas, then seromas. Then inflammatory or blood vessel conditions. It could be Crohn's disease, it could be diverticulitis, it could be abdominal or aortic aneurysms, it could be an enlarged liver or enlarged spleen, okay, hepatomegaly or splenomegaly. So generally, okay, depending on the tumor size, where the tumor is located, patients may complain about similar things, okay, like abdominal pain or discomfort, visible or palpable lump. So you are saying something is big and is visible, you can see it, okay. Abdominal bloating or fullness, nausea or vomiting, constipation or diarrhea. Then they are actually losing weight or gaining weight depending on the condition, right? So there's blood in stool or urine, that's hematochezia, hematuria, okay. So there's also fever or fatigue, okay. So I just brought fibroids here based on gynecological issues. Can be fibroids or so. So if you want to diagnose such a thing, it's actually deep in the stomach, you understand? So you have to do imaging to see inside that area. So ultrasound, CT scan, MRI, endoscopy or colonoscopy, then blood test and all, okay. Then biopsies just to determine if what is actually growing is cancerous or not. So treatment, you can go for medications, you can go for surgeries, you can go for chemotherapy or radiation therapies, and sometimes if the tumor is small or there's no issues coming up with it, you can just tend to monitor it for that time being.